Welcome back, everyone, to the Legacy Years podcast. This is a podcast where we talk about embracing the joys and challenges of aging. And my goal is always to share valuable tips and information that can help folks do just that. And I'm back here with Melinda. And if you missed our first podcast, we talked about the myths of Medicare. So go back and listen to that one first, although you can listen to these in any order that you want. But we're moving on in Medicare because it's such a big topic. We have broken it down into 4 different conversations that we're going to talk about with you guys. And this next one is going to be about the differences between original Medicare with gap insurance versus Medicare Advantage. And I know, boy, I tell you, that's a confusing topic, even to me. And so why don't we just dive right in?
Sure.
I don't know how long this is going to take, but we're going to try to keep it in that 20 minutes like I always try to do for you guys.
All right. So, hi, my name's Melinda again. And again, as Kristy said, go back and listen to the other myths one. It's really good. But for this one, I'm going to hit that hard topic of what's the difference between original Medicare with a Medigap policy and a Part D drug plan or Medicare Advantage. It really, really is a crucial decision. Okay, so we are going to dive into what I call your path decision. Now, when I say path, technically what I'm talking about is the type of coverage that a person is choosing. Original Medicare with a Medigap policy and a Part D drug plan or Medicare Advantage. Now, notice my hands. The reason I'm doing this is because literally I want you to imagine yourself standing at a fork in the road. When you are first fully enrolling in Medicare, you need to make a path decision. Are you going to head down the path of original Medicare with a Medigap policy or Medicare Advantage? Now, the reason that this is such an important decision is because as soon as you choose one path or the other, you may never be able to change your mind, come back to the start, and choose again. Okay. Very often, this path, once you start walking in one direction or the other, can become a one-way street. You can't go back and redo it. So now, I want you to imagine yourself again at that fork in the road. Original Medicare with a Medigap policy or Medicare Advantage. First, I'm going to talk about how original Medicare with a Medigap policy works. All right. The first thing I want you to imagine is that we're going to put the U.S. Capitol building in the very background. Can you see it? Can you see it? Yep. The U.S. Capitol building's back there. The reason we're building the Capitol building way out there in the distance on this path is the government is your health insurer on this path. Let me say that again. The government is your health insurance company. The government decides what healthcare services are covered by Medicare and what is not. The government is your health insurance company. Now, one of the biggest benefits, I believe, in choosing original Medicare is the freedom to see any doctor that are Medicare. Now, let's say, for example, Kristy, I'm going to make it up. I'm going to say to the world that you live in Virginia. Congratulations, you now live in Virginia. But let's say you're traveling to see family in Florida or Alaska or Washington State. Wherever you go within the United States, you can see any doctor that accepts Medicare, go to any hospital system that accepts Medicare. This includes Mayo Clinic, Cleveland Clinic, Johns Hopkins, MD Anderson, Northwestern, USC, whatever. University of California, based out Southern California. All right, you can go pretty much to any hospital system that accepts Medicare. Now, the exceptions are for my folks on the West Coast, Kaiser Permanente system, or in Texas, Kelsey people. Those are the big exceptions. If you want this, you have to choose Medicare. But everybody else, ton of freedom and flexibility to see who you want to see. And when you see a doctor or go to a hospital, almost as a rule, your doctors are in charge of what happens from a health. Very rarely do they need to reach out to the government to get the government's permission? Very rare. It's called prior authorization. And in fact, in 2023, there were only about 400,000 in the entire country in the entire year cases of required prior authorization on original Medicare. That's it, 400,000. Now, so doctors are in charge. If Medicare covers the service, your doctor can say, okay, we're going to start chemotherapy after. Boom. All right, doctors are in charge. The Capitol building in the background because the government is your health insurer. Now, you would get started on this path by enrolling in both Part A, hospital coverage, and Part B, medical coverage. Technically, Kristy, you could stop right there. You could say, I'm done. I'm enrolled in Medicare. I'm out of here. I'm not doing anything else. Yeah. The problem with that is the fact that Part B would leave you paying 20% every doctor bill, every specialist bill, every chemotherapy visit, every surgery, every lab, every diagnostic. No spending limit in sight. Every time you were hospitalized, for the most part, there are details and nitty-gritties, but essentially you would have about a $1,700 hospitalization deductible. There's a lot of cost that you would be paying if you only had Medicare Part A and Part B. So, Chris, I'm not going to let you stop there with just A and B. I know, terrible, so far. So on this path, we are going to now add, in addition to the Capitol building in the background, we are now going to add 2 additional buildings, and we're going to put them across the street from each other. We are going to put a Part D drug plan. Part D drug plan, Part D stands for prescription drug, Part D drug. A Part D drug plan helps to cover the cost of any prescription medication. Now, across the street, we are going to put a Medigap policy. The reason they're across the street from each other is because they are both provided by private insurance companies, but different insurance companies. You do not have to get these policies from the same insurance company. And in fact, for the most part, it's better for them not to be from the same insurance company. You choose the coverage that is best for your unique needs. Very often, that means those 2 policies come from different insurers. That's why they're across the street. All right. So you pick a Part D drug plan, you take your medications, and you align it with a drug plan that best covers those medications. All Part D drug coverage comes through private insurance companies. The goal is the private insurance plan that best covers your medications. Okay. Yeah. The Medigap policy is a very, very unique insurance. People like to think my Medigap policy is health insurance. It's not health insurance. Remember, on this app, the government is your health insurer. The Medigap policy has one job: to cover the costs that Medicare would have left you pay. That's it. That's the only job of a Medigap policy. It can't say what doctors you will see or can't see. It won't say what services you get or don't get. That's the job of the government. The Medigap policy's only job is to cover the costs that Medicare would have left you pay. Thus, it covers the gaps, the payment gaps that Medicare would have left you pay. That is gap. That's where the term comes from. Now, so even though Medigap policies are often provided by names like us, say United Healthcare, it's not health insurance. You follow the health insurance rules of the government. If the government covered something, the Medigap policy has to pick up the cost per a federal standardized schedule. They don't even get to choose what costs they'll cover or don't cover. Wow. It's all standardized. So essentially, when you get a Medigap policy, it doesn't matter whether you get that coverage from Blue Cross Blue Shield, from United Healthcare, from Old Charity, Lumico, Mutual of Omaha, Medico, Allstate, State Farm. These are all Medigap insurance companies. Bet you know that.
I did not know that.
So
I'm surprised by those names.
Right? And some of those you won't know, and that's okay. I liken it to choosing a brand of sneakers from Costco or Sam's Club. They're going to protect your feet and let you jump just as high on the basketball court as a Nike or a Reebok. It's an off-brand, essentially.
Yeah.
Exact coverage. Different prices, same exact coverage. There is no need to necessarily go get a brand name Medigap policy. It covers you exactly the same as names you don't know. So that's a really important thing to understand. The goal of a Medigap policy is to choose coverage then based on price and how premiums will increase over time. Are they going to have a lot of premium increases and essentially double in premiums every 10 years? Or are you going to get a policy with very low increases? It will take 15, 20 years to double in premiums. That's the goal. So Medigap policies are very, very unique animal. Medigap policies, again, the coverage has been standardized in 47 states by the federal government. Plan G is greatest. Plan G is the greatest amount of cost coverage you can get. Plan N is next. G greatest, N next. I kind of like to forget about them. For the most part, forget about A and C and D, K and M and L. Forget about those. G is greatest. And so look at those by and large. F, right now, people have often heard of a Medigap Plan F. Plan F used to be the greatest amount of coverage, but as of 2020, people turning 65 can no longer get F. It's not open to new people anymore. So what I will say is F is full. You don't necessarily want an F because the goal of insurance is to share risk. You want to share risk with as many healthy people as possible. If Plan F has no new 65-year-olds going into the plan, guess what's happening? The risk pool is, I'm sorry, it's just a fact, is getting older, sicker, and getting smaller, dying off.
Yeah.
You don't want to share risk with sicker, older, and fewer people. You want to share risk with as many healthy, younger people as possible.
Right.
All right. So on the path of Medicare, fully built out with A and B through the government, a Medigap policy plan is greatest, or N is next, and the Part D drug plan. Essentially, this package gives you very predictable healthcare expenses. Once you pay the monthly premium for Part B, the Medigap policy, and the drug plan, you will have any additional out-of-pocket costs for healthcare services. Kristy, you could be in the hospital for 4 weeks and not get another bill.
Wow.
Okay, so it's a very budgetable approach to receiving and paying, receiving healthcare and paying for healthcare expenses. That's original method. Now, the other path, let's go. All right. So on this path, first and foremost, there's no Capitol building back there. There's no Capitol building. Now there's a big, tall corporate building. When you choose the path of Medicare Advantage, the government, no, you give up the government version of Medicare. Instead, you take a private insurance company's version of Medicare. And it's important to understand that. So you will essentially have the government in the back. You have a corporate building. The insurance companies are in charge on this path. They get to make the rule. And that is important to understand. Now, just to confuse everybody in the room, you still have to be enrolled in the government Part A and Part B. You will still have your Medicare card and Part A and Part B through the government, but you will get no hospital services or no medical services through the government. So why do you have to be enrolled? Because you are paying Part B premium this month, and there's a certain amount of money in the government trust fund, the Part A trust fund, set aside for you. You have to be enrolled in Part A and Part B, so those money gets transferred to the private insurance company.
Then I never knew that.
And
never. It's like a voucher system.
So then the goal of the private insurance company is to keep as much of that money as they can. That's just how it works. So you have your Part A and Part B card, but you can't take it to the doctor. Take it to a hospital and have it pay for it. You can keep it at home in the safe deposit box. Instead, you carry around your private insurance Medicare Advantage card. Now, there are a couple of things that make Medicare Advantage plans so attractive. Now, first and foremost, Medicare Advantage plans for the most part roll in through coverage. There's no need to go get a standalone plan that covers everything. So you can carry around one card rather than three on the path of original Medicare. Now, the second thing that makes this so attractive to so many people is 5 words. I'm about to say 5 words. $0 in monthly premium. I didn't say free. Free is one word. I said $0 in monthly premium. Do not translate that into free in your head. By law, these plans cannot say they are free because they are not. They have costs. So the second thing that makes these plans so attractive is free dental, free vision, free hearing, free gym membership. Get all the benefits coming to you. Thank God Joe Namath is off air. He's now selling hearing aids. But the damage has been done, and people, when they think Medicare Advantage, they still think free gym memberships, free dental, free hearing, free vision. It is true. 97, 98% of Medicare Advantage plans in this country include extra dental, hearing, fitness, vision benefits that you typically do not get on the path of original Medicare. You, yes, will have extra benefits. But when people say free dental, they get it all wrong. Because normal people think of free dental and go, oh, that'll be great. When I need denture, when I need crowns or extraction, I'll get whatever I need. No, that's not what we're talking about. 60% of Medicare Advantage plans in this country cap dental benefits annually at less than $1,000. The most you are going to get in terms of benefits, dental benefit, on these plans is less than $1,000. One crown typically costs $1,200 to $1,800. You're not going to get one crown, much less crowns, bridges, extractions, dentures. So know the limit of these free benefits. They often have networks. They have co-pays, co-insurances. Yet you know what the restrictions are, the hoops you have to jump through to get the benefits. Vision, the free eyeglasses. Yeah, the last time I got free eyeglasses, they were $500. The national vision limit on Medicare Advantage plans is about $160. I'm
Pay
not
for your
getting
friends, maybe.
glasses. Right. I guess this part of my eyeglasses I got.
No, part of your friend.
Right. Yeah, it's nice, but the reason that I'm bringing this up is because people get so focused on these free benefits that they forget to ask the most important questions. What happens if I get cancer? What happens if I have a stroke or a heart attack? Will I be able to go to the hospital that's just down the street, or will I have to drive 2 hours across town to see a doctor I don't know at all, and then wait 7 days while the insurance company decides whether or not they think I need that surgery or that chemotherapy treatment? So please ask the questions. Keep your eye on the ball. Why do you have health insurance? Now, on the path of Medicare Advantage, to use this package of coverage that you get, you have to follow 3 critical rules. Rule number 1, network. So remember I said on the path of original Medicare, you can go to any doctor that accepts Medicare and hospital system anywhere in the country. No, that is not the case on Medicare Advantage. you need to be aware of networks. Now, there are a lot of PPO plans, but PPO plans on Medicare Advantage do not mean necessarily that you can go out of network. Fun fact, and I don't mean fun actually, providers out of network have no legal obligation to take out of network coverage. They do not have to take out of network coverage. When you show up at the door with out of network insurance, they don't have to take it. Wow. As a result, what we are seeing right now, 39 health systems in this country have basically said, that's great that you have Medicare Advantage, go somewhere else.
Wow.
Scripps, Southern California is one of the first people to do this. If you want to see a Scripps doctor in Southern California and you have a Medicare Advantage plan, you're going to have to pay out of pocket or take it somewhere else. So beware, networks matter. Networks can also change at any time. That's rule number one. Rule number two, prior authorization. Prior authorization means that your doctor may say, Kristy, you need shoulder surgery. And you're like, gee, doc, I don't want to, but okay, let's schedule it. I know. We have to get the insurance company's permission because ultimately the insurance company is in charge, not your doctor. Your doctor's just a guideline. So it'll take up to 7 days for the insurance company to decide whether or not they think you need shoulder surgery. If they decide that you don't really need that and you go ahead with the surgery anyway, you pay the whole bill. Whether that bill is $20,000 or $200,000, that's yours to pay because you didn't follow the rules. Prior authorization is basically everywhere on Medicare Advantage now. 99% of plans require prior authorization for hospitalization or durable medical equipment for chemotherapy treatments. So beware that insurance companies have to get permission from. By the way, remember I said there were about 400,000 prior authorization requests for Medicare last year. There were 48.9 million prior authorization requests.
Wow.
400,000, 48.9 million.
My goodness.
You do. So it's a beware of the restrictions on care. The last rule is you are responsible for paying deductibles and copays whenever you use healthcare services up to the plan's spending limits. So they're not free. The limits can be as high as $93.50 in network, $14,000 in and out of network. Now, the reason ultimately this all boils down to a fully important decision is because ideally you would go Medicare Advantage while you're healthy, and then when you're no longer healthy, switch to original Medicare and get a Medigap policy. That's how ideally. But here comes the glitch. As soon as you choose your path in 47 states, boom, an earthquake happens behind you. Now, if you decide you don't like the path that you're on, if you want to switch, one can't just willy-nilly switch. There's a huge chasm right there. You can only make changes when a bridge is open. Bridges are open typically October 15th through December 7th, but like bridges from the United States to Canada, you can't just willy-nilly cross. There are rules. If you start on the path of original Medicare and want to head to the path of Medicare Advantage, that's actually very, very easy peasy lemon squeeze. But if you start on the path of Medicare Advantage, and now let's say you're not healthy and running into prior authorization restrictions, network problems, and you want to go to original Medicare, you try to cross, yes, you'll get Medicare Part A and Part B through the government, but in 47 states, it is very likely you will no longer be able to get a Medigap policy. After the first 6 months of being enrolled in Part B in Medicare, you lose your guaranteed issue right. Insurance companies now ask questions about your health. If they find anything they don't like, they can say, no, Kristy, we don't want you on this coverage. And Kristy is so shocked, she goes, no.
I've been sitting still too long.
So, but yes, that's ultimately what happens. So that's why this decision is so important. When you make the decision of original Medicare versus Medicare Advantage, when you're 65, 67, 68, don't just take your health today. Don't just look at that today. You need to be looking 20 years down the road potentially. What do you want your healthcare to be like years from now, not just for today? Do you think you're going to be healthy until you die? It is important to understand. And for some people, the answer remains Medicare Advantage. And that's great. As long as you make the choice, eyes wide open, good, bad, and ugly, that's good. I'm totally in favor of that. What I'm not in favor of is choosing a healthcare coverage based on free dental, which it really isn't even free.
Right.
So understand what you're choosing, and you know that decision can become a permanent decision.
Yeah. Melinda, thank you. That was so comprehensive. And for people who were confused before, I think that they will really understand, now the differences between those two. So thank you. That went a little long, but I think it was so important. And I appreciate the clarity and how you described it.
Thank you. Well, that's probably the biggest reason we have a company and do what we do is basically how we explain Medicare to people. So, yeah, we tried.
Well, y'all do good. So, guys, we're going to come back and do a third conversation all around open enrollment. And so if that's something that you're confused about or you're interested in, look for the third in this series. Thank you, Melinda.